Erectile dysfunction affects up to at least 30 million American men, and about half of those men seek treatment. So there's a huge population of men who are underserved. It typically, on average, affects men in their early 50s, classically into their 60s, but by some estimates, as many as 30% of men in their 30s and 40% of men in their 40s may have some occasional episodes of erectile dysfunction.
As a consequence of some surgery for what was thought to be a hernia some 10 years before or maybe a little bit longer than that, I, in the aftermath, noticed some, at the time we called it impotency, and making no secrets about it, I was completely devastated by that. It was psychological. It was everything, and my wife at the time, who's passed away now, was very understanding, and it wasn't a life-changing thing, but it was a life-affecting thing.
Oftentimes we'll have issues with erectile dysfunction as the first sign of cardiovascular disease, diabetes, high blood pressure. So it's important to listen to your body and understand that it may be a sign of other medical issues.
That's probably the biggest hill to get over, is just to get someone to talk about it. And it's the kind of thing that a lot of men, regardless of how macho they may think they are and so forth, it's either a subject they avoid or they lie about it.
At the initial visit, we'll review your medical history, discuss risk factors, their potential role in your condition, and also encourage you to bring your partners to talk about how it affects your relationship and discuss treatment options that might be right for both of you. Most patients are able to leave with a very thorough understanding of the options that are available, some of the reasons and risk factors that may have led to erectile dysfunction, and what type of success rates we would expect from the options. To start off with, the first-line therapy that we typically will recommend for patients is a trial of many of the common oral agents that you see advertised on television. In general, all three of the oral agents, Viagra, Levitra, and Cialis, are very similar in chemical structure and mechanism of action. The thing that differentiates them oftentimes is the duration of therapy that is expected with the oral agent, as well as the time to achieve kind of the appropriate level for sexual function. The next option for management of erectile dysfunction is what we call a vacuum erection device. This is basically a sleeve that is placed over and around the penis, and there's actually a pump that creates a vacuum after creating a seal against the skin that will pull blood into the penis. The third option involves the injection of a drug into the penile tissues, which actually stimulates and improves the flow of blood into the penile tissues. It works directly on the blood vessels within the penis, and therefore the dosing is very important. It can be very effective, and probably the biggest disadvantage for most patients is the thought of actually injecting a needle to administer the drug into the penis. The drug itself is responsible for the duration of the erection and not the degree of sexual stimulation or sexual arousal. And therefore, again, one of the major risk factors is a condition known as a priapism, where there's essentially too much drug administered, and patients will have to take a visit to the emergency department to get an antidote shot. The final option is the implantation of a penile prosthesis. Implantation of a penile prosthesis involves a surgical procedure where a small incision is made to implant the components of the device. The inflatable penile prosthesis consists of two cylinders that are placed within the penile tissues. They're made from a silicone type material, and they're connected to a pump which sits within the scrotum. It's well hidden and difficult to identify within the scrotum. And then finally, there's a third component that we refer to as the reservoir, and this holds the fluid that's essential for inflation and deflation of the prosthesis cylinders. That reservoir is placed behind the abdominal wall, so it's out of sight and you can't feel it. When you're ready for a rigid erection, there's a pump mechanism within the scrotum that is pressed, and slowly the penile cylinders will fill with solution, saline solution in this case, from the reservoir.
When it's described, the pump and so on like that, it sounds pretty mechanical and this sort of thing, and it is a, you know, it's a very comfortable situation to do it.
And then when the erection is no longer desired, a release valve is triggered in the pump manually, and the fluid flows out of the cylinders and back into the reservoir. The cylinders, when deflated, have a very natural appearance similar to a flaccid penis.
It is comfortable. It is not bothersome at all. It is relaxed.
In general, patients report the highest satisfaction with the inflatable penile prosthesis as compared to injections and oral agents. At Urology of Indiana, we want you to know that erectile dysfunction is a common condition. There are important reasons to seek evaluation and treatment, and there are a number of treatment options available so that you don't have to live with the condition.